Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing a program that is an easy extra sale that your prospects all need and generally ask for, particularly during AEP, a nice companion piece that fits into the product mix that you need with a scope of appointment, and it works really well simply by, in many cases, asking that one more question. We'll record today's presentation, and the presentation itself, along with some of the other information we'll reference through the course of the presentation, will come to you as follow-up as soon as the recording updates. A little bit of background on Premier Marketing. If you're not familiar with us, we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country and act as an insurance wholesaler offering insurance services through independent insurance agents such as yourself, with contracts that are at the highest possible commission levels, with recruiting contracts available for those who qualify. As I mentioned, we were founded 50 years ago last year. So that's a bit of a milestone for us and a true success story for an agency that started as a small family shop in rural Nebraska. That's become one of the largest programs of its type in the Medicare space for Medicare Advantage and Medicare supplement programs and ancillary programs such as today's programs. We do so through a full insurance portfolio that include those Medicare Advantage and Medicare supplement plans, also offering Part D standalone prescription drug programs, a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long-term and short-term care products, disability income programs, and ancillary benefits that include dental, vision, and hearing programs, critical illness, cancer programs, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that can make a difference for you in your market. And that same philosophy carries over into the prescription drug programs, where those national carriers are there for you to access for the folks that need that standalone coverage. Many times that's because they choose a Medicare supplement as the coverage of choice for their Medicare expenses, and we have a full, robust portfolio of those programs for you to utilize, including tools to help make you successful in that space as well. Those ancillary products, well, in each of those categories, those name carriers are there for you, including our partner of today with SureBridge, and we're very pleased that they're able to come on and visit with us today about a program in the dental world that is a great add-on product for you. When we look at the Medicare market overall, obviously you don't come on a program like this without someone talking about the aging of the baby boomers and how many people are coming on board for eligibility for Medicare each and every day. A person every 8 seconds, 10,000 plus people a day. And it's a nice market to work year-round because that's not the entire number. These are folks that are eligible for Medicare based on age, but you got to consider about a sixth of the Medicare market are actually under the age of 65 and accessing those benefits through disability. So it's a area where you have a diverse need of people with different types of conditions, different health conditions that have additional needs outside of just some of the base coverage. And sometimes that comes with a little bit of an impediment when it comes to their wallet as well. So having a program that helps them budget ahead of time can be very, very helpful to them. Because, of course, they have choices when they access their care. They can stay in the traditional system and add a Medigap policy and a prescription drug plan as necessary, opt into the private sector with Medicare Part C, and then look for additional programs to help in areas of other need where these options don't give them all the coverage they need for certain types of coverage, and that includes dental coverage. So when we look at the dental market overall, we see that a large percentage of the Medicare population doesn't have dental coverage at all. And half of them haven't been to the dentist in the past year, and they spend more than $1,000 on out-of-pocket expense, about 1 in 5. There's also a number of those folks that don't have natural teeth. So that most expensive of dental coverages, the dentures, come into play for many of these people. It's also a circumstance where people say they plan to visit the doctor and then they don't. And in many cases, that's because the budget doesn't allow for it. And so the need for additional assistance in the area. It also gives us an opportunity to use dental coverage for folks that, well, it takes away the excuses. And the biggest excuse that many people have with not visiting the dentist is the cost. So being able to budget for that ahead of time can make a huge difference. And that makes a big difference because it affects people across the spectrum. So whomever you deal with in the Medicare space, they have some of the same challenges with the income and health status that asks for additional coverage. In many cases, for folks who work in the Medicare Advantage space, they will note the fact that many people that select that type of program do get some sort of dental coverage. But you'll see that for many people, that is not sufficient as well. So adding on a fee-for-service program that pays independent of those plans can be of great help to the people you're serving. Because let's face it, Medicare covers limited dental services, and we need additional help for many of the challenges that we have with our teeth at any age. This is a bit of a reiteration of an earlier slide that emphasizes the fact that 2/3 of the people on Medicare have no dental coverage, and sometimes the sales pitch is as simple as asking, what are you doing for your dental care? This is a reinforcement of the fact that many people who have Medicare Advantage still need some additional help, and many of those folks are very much interested in additional coverage. Sometimes it's just a question of, do they know you offer it? Even the duals can use some help in this area, and because many of the plans are very cost efficient, it's still a possibility for a sale with folks that are of limited income. It's very important too that we bring this up because many times different chronic diseases are actually diagnosed through the dental office, and it gives us an opportunity to help people with their overall health. That brings us then to our guest presenter that helps us today to visit on the SureBridge program. That's Mr. Mike Zundell. He's the Senior Sales Director for SureBridge. And Mike's going to walk us through a program that many of you will find a simple add-on to sales during AEP and year-round. So Mike, I am going to switch control of the comm over to you. And there we go.
All right.
And I'll shut up.
Excellent. Well, John, thank you so much. You teed that up perfectly for me there. Just to be sure, you are seeing my main monitor right now, right, with my title screen?
Absolutely. SureBridge, ancillary products. Your clients need this AEP.
All right, there we go. Well, hey, everybody, I really appreciate you guys jumping on the call today. Means a lot to me to get you guys to take 45 minutes out of your time during AEP. It really shows me that this is something you guys are really seriously looking at. So it means all the world that you joined us today. Real excited to talk to you guys about really two different products that we have as solutions in the senior market for your MedSup and Medicare Advantage clients. And man, I mean, John did such a good job of showing you guys what a market opportunity there is and how many seniors actually need dental insurance, and how many are just going without seeing the dentist at all because of the simple cost prohibitive fact that without insurance, many seniors just cannot afford the cost of going to the dentist. So today we're going to talk a little bit about how we've got a great solution for that. And then we're going to transition, talk about another product that we have that's an excellent fit for your Medicare Advantage clients as well. And I'm going to finish off with showing you guys a little tool that makes the Medicare Advantage cross-sell even easier for you guys. I think you'll be excited to see that. Before I get into it, though, I wanted to share with you guys a little bit of info about SureBridge, because it's possible some of you may not be too familiar with us. And first and foremost, SureBridge is a marketing name itself. The name of our company is actually the Chesapeake Life Insurance Company, but we have branded all of our products under that SureBridge brand. So you'll see us kind of use those terms interchangeably at times. You may notice at the bottom of the screen there on our logo, we've got SureBridge underwritten by the Chesapeake Life Insurance Company. And we've become kind of the best kept secret in the senior space, as we are one of the largest and fastest growing ancillary health carriers in the industry. Traditionally, we have focused more on the under age 65 our market, creating these same sorts of products to help fit the gaps in a in a non-seniors health insurance portfolio. And now with our partnership with Premier and this new product that we've launched and a couple of other plans in our portfolio, we are really seeing that transition into the senior space and really firmly entrenched now, helping you guys with the needs of your senior clients. We did $134 million of submitted annual premium last year. And like I said, with this new partnership, we're really excited. We think we're going to blow that number out of the water in 2019. There's never been a better time for you guys to contract with SureBridge and start telling your clients about us and what we offer, because as of this past spring, we were actually purchased by United Healthcare, and we are part of the United Health Group family of companies now. And with that, overnight, we got to upgrade from a B++ carrier to an A-. So we are now an A-rated carrier and part of really the preeminent health insurance company in the United States. So if you ever have a case where the client may say, I don't really know who SureBridge or who Chesapeake Life is, well, now they can rest assured that, again, we are a part of that United Health Group. So for us, it was so exciting that United believed in what we had been doing over the past few years, and they were excited enough to add us to their mix. So when you look at the SureBridge portfolio, just specifically in the senior market, we've got quite a few products. Not going to really talk with you guys about everything today, but you do see we've got a HospitalWise, we've got a final expense. We do have a standalone vision and dental plan. We've also got a senior critical illness suite of products. We call it the CIY suite. We can sell that as a standalone cancer benefit or a standalone heart stroke benefit, or we can add those two together and even add the critical conditions rider on that plan. And when we've got all three of those bundled together, now it looks more like a traditional critical illness plan. And then finally, we have a fixed indemnity product as well. I think what you guys are going to see, though, I'm going to tell you a little bit more about the HospitalWise, and I think that's going to be really the preferred ancillary plan to sell to your single client or your senior clients. And one thing you did not see on the screen is our brand new product, and the one I'm really going to start the conversation with you guys about today, and that is Prime DVH. And for me, Prime DVH is the absolute biggest slam dunk of a cross-sell product for your MedSup clients. John kind of alluded to this earlier, but of all the products out there that you can cross-sell, dental or a dental vision hearing plan are things that almost sell themselves. I mean, your clients, if they do not currently have dental insurance, it's very likely on their mind. And it's something that just as a society, we've been so used to having dental our entire lives that we know the importance of it. And many of your clients may have just lost their group dental benefits that they had through work. And I think more often than not, you're going to find when you just mention the word dental, you're going to get a positive reaction. So let's talk a little bit about that market, though. There are over 37 million traditional Medicare fee-for-service enrollees, and only about 21% of them right now have private dental insurance. So that other 79% of that 37 million right now is really going without anything. And then John talked about this too. Don't think that with the Medicare Advantage that there's not still potentially a need for a product like DVH. There's actually over 8 million Medicare Advantage enrollees right now that have no sort of embedded dental coverage in their policy at all. And then further to John's point, really many of the Medicare Advantage plans that do have some embedded dental, they're very good on the preventative side, but they can be a little sparse in terms of covering basic and major dental services. One great thing about this product, Prime DVH, is that we do not coordinate and we do not subrogate with any other insurance that the client may have in force. So you can sell these to a Medicare Advantage client that has some embedded dental, and we can stack nicely right on top of that and work in conjunction to really get your clients the maximum dental benefit and, of course, vision and hearing benefit as well, that they can have access to. And then finally, like I said, we are not a senior-only company. All of these plans are actually available in the under age 65 space as well. And when you just look at the whole market right now in our country, about 1 in 4 Americans, so 25% of our country, do not have any sort of dental insurance. So again, the market for a plan like this is just absolutely huge. And I think the next thing you got to think about, well, okay, so a lot of folks are going without dental insurance, but why is that so important? And again, John was really alluding to this and the thought that, today we are now seeing this stronger and stronger correlation to having dental benefits and going to the dentist every year and having lower incidence of these other sort of chronic diseases. So first and foremost, just going and getting those regular cleanings and checkups at the dentist each year, they are the front line to detecting oral cancer. And, it's really important because when we find oral cancer early enough, it's actually a very treatable and curable disease. We can lower the chance of it spreading by up to 90% if we catch it early. And again, to me, that is reason enough alone. We've got to make sure all of our senior clients are going and seeing the dentist each year. Now, you guys, I'm sure, would associate things like preventing gum disease, gingivitis, cavities, tooth loss, bad breath. Those are probably all things we think about as reasons to go to the dentist and things that we're fighting. But here's what I was talking about with the data that's come out recently. Individuals that don't have dental benefits are 29% more likely to have diabetes. They're 50% more likely to have osteoporosis, and they are a whopping 67% more likely to have heart disease. So again, these correlations are too strong to be ignored, and they are huge reasons that we've got to get our seniors to go and see their dentist every single year, hopefully twice every single year. Now, when you think about hearing and hearing loss, you may not think of that as that big of a deal, but it's actually the third most common health problem in the United States today. And likewise, it's linked to other things like cognitive decline, brain tissue loss, depression, and even dementia. And there were almost 29 million adults in the United States right now that could benefit from the use of hearing aids. I'd like to bet probably most of you on this call know of 1 or 2 individuals firsthand that could definitely use some hearing aids. And then finally, I found this fascinating. Vision exams now are often the first to detect a number of different chronic diseases. So now 20% of the time, this is how people are being diagnosed with diabetes. 30% of the time, it's how they're finding out they have hypertension. And 65% of the time now, this is where people are getting their diagnosis of a high cholesterol. And it's very interesting. The optometrist gets in there for the vision exam, and they can see the markers in the eyes for these other sort of chronic diseases. And it's a great, again, preventative tool, just like John had referred to. My boss is actually good friends with an optometrist, and he told him recently that he's sending about 15 to 20% of his clients on to see some other sort of specialist just as a result of things that he is seeing in those vision exams. So when you add all three of these things up, and we want our seniors to live the healthiest lives they can live, and we want to make sure we are doing everything proactively to fight off these sort of chronic conditions, I think you can see getting them to go see these 3 specialists every single year is really paramount to help and make sure that we're doing that for them. And again, making sure that they really are living the best, healthiest lives that they can live. And that's where Prime DVH comes in, and where this plan is really different than everything else that's in the market today. Okay, so your client can buy this plan today, and tomorrow they'll get all of their preventative dental covered at 100% from day one with no deductible. So when you're thinking about preventative dental, think about the cleanings, the exam, and the x-rays. In addition to that, they can get their vision and their hearing exams covered at 100% from day one with no deductible as well. So again, I've been beating that drum really loudly that, hey, we got to get our seniors to go see these 3 specialists every single year. And now with Prime DVH, we have a way that they can do that and buy the plan today and go tomorrow and see all 3 of them with absolutely zero out-of-pocket costs. Okay, some other features that really stick out on this plan, we have a no waiting period for the basic dental procedures. Typically, you'll see a 6-month wait for basic procedures on a plan like this, and then just a 9-month wait for the major dental procedures, as opposed to the full 1-year wait that, again, you see on a lot of these types of products. So another competitive advantage for us, shorter waiting periods on the basic and the major dental services. And again, really no waiting period for the basic at all. The commissions on this plan, since you guys are working through Premier, you guys are going to find are really kind of untouchable. Premier is a sort of an organization that passes really more of the commission onto their agents as the lifeblood of the company, and you guys are just at such an advantage working through Premier over some of the other marketing organizations that are out there, and that higher comp is just one of the things that they really excel at, obviously, kind of unparalleled in many aspects. And then also, when you look at the premiums for this plan, you guys are going to see this is really a market leader in terms of a low-cost product. There's some other plans out there. They're going to look pretty close to us, but really nothing is going to match this product when you combine these early-on benefits that you can get day one with that low premium. So very confident you can stack this up against any other plan out there in the market. And the other thing that when we made this plan, Premier told us was very important is that we have the ability to have the client go out of network and not take a huge benefit reduction. On most dental plans and DVH plans, if the client goes to an out-of-network provider, the company is going to pay a smaller copay as opposed to if they went in-network. Well, with this plan, we did not do that. We created what we call the passive network. Okay, so your clients are going to have the ability to go in-network, but when they go out of network, oftentimes they're going to get the same percentage benefit. The big difference is if they go in-network, we're going to base our payout on what that dentist actually charges. They go out of network, we are going to base that benefit on the 75th percentile of the usual and customary charge for that procedure in that area. So that might kind of sound like a mouthful, but think of it this way. Unless that dentist is charging more than 75% of his or her competition, this plan is going to pay out at the exact same percentage as if they had went to an in-network provider. So we're really combining the best of both worlds here to where you have access to a network where you can get even additional discounted pricing, or if they're in an area where they just don't have good network solutions, or maybe they just have an out-of-network dentist that they already love and don't want to have to switch. In most cases, again, they're really not going to have to take any sort of a benefit reduction. Here are some sample premiums on the plan. You can see we've got 3 different benefit amounts, and we've got 5 different age bands. Okay, so the benefit amount, that's going to be the annual maximum benefit between the three offerings. Okay, so you're going to have a maximum within these maxes. You're going to have an internal maximum of $500 every 2 years for the hearing insurance, and then a $200 benefit every year for the vision insurance. Okay, no internal max on the dental though. They could buy the $2,000 plan and they could really spend all $2,000 of that benefit on dental services if they need to. Another great thing about this plan is issue age premiums. So the premiums do not jump up as your client ages. You might notice we have an age bracket there that ends right at 65. So great way to create that sense of urgency when you're talking to your clients if they're 64 or they're 65 and say, hey, let's get you this DVH plan today because we don't want to wait another year until you're 66. You might be paying as much as $14 more per month in premium as opposed if we get you locked in at that younger age group today. John alluded to this, but it really is funny. I've got to go all around the country and talk to agents that sell these sorts of plans and talk to agents that really don't cross-sell any sort of products and really just stick to the Medicare Advantage or the Med Sups that they're selling. And every time I kind of pick the brains of the ones that have really successfully integrated these ancillaries into their sales process, they always tell me, Mike, it's I don't really have a secret bullet to give you. It's not really necessarily rocket science or anything that difficult. It is just a matter of making that commitment to bring it up to every single client that I talk to. And they'll tell me, I don't care how busy I get in the middle of AEP, These plans are an important component of the insurance that I'm offering my client, and I'm going to make sure I don't let a single client out of my office without me talking to them about their dental needs. And here's some really great, easy questions you guys can use to have that discussion. Just simply ask your clients, when was the last time you had your teeth cleaned? How long has it been since you've seen your optometrist? And when's the last time you completed a hearing exam? I think you'll be surprised. Many of your clients are going to say, oh, I don't know. It has been a while. I saw the average senior has not been to the eye doctor in over 5 years. So again, these are 3 specialists that just so many folks are not going and seeing every year like they need to. And also just make sure they are aware, your traditional Medicare and your MedSup, it's not going to cover your basic dental services. There is no benefit there for vision exams, glasses, and contacts. We don't have anything in those plans that's going to help you pay for your hearing exams or your hearing aids. And that's where a product like Prime DVH can just be such a valuable way to round out really the whole package you're putting together for your client. So we're really excited. We just launched this plan in select states back in April, and now we are all the way up to 36 states plus DC. And at the end of the month, we're going to be launching in Alaska as well. So we'll be up to 37. So still a few stragglers out there. We have not gotten approval on them. We're still working on that. So hopefully we'll have those 2. I think this is going to be the end of what we've got for this AEP, but look for more state approvals to come through in early 2020. So like I said, now that we talked about Prime DVH, and again, if you have any questions, please type them into the chat feature, and John can get those out to me at the end of the call. But I want to talk to you guys now about another plan that I think makes even more sense for your Medicare Advantage clients. Okay, and for me, just like the Prime DVH is the absolute must-have to pair with a MedSup, a product like our HospitalWise plan, which is a hospital indemnity plan, is just a essential way to fill the gaps in your client's Medicare Advantage plan. Okay, one thing you really want to make sure I'm clear on, I think some agents don't always think about this, but when you're looking at what a hospital plan can do when paired with the Medicare Advantage, it is much more than just covering your client for a hospital confinement. By utilizing the different riders that we have available on this plan, we can actually take all of those other copays that we see, I call it the death by 1,000 cuts on these MA plans, and we can provide a benefit that's going to actually pay them cash if they have any of those triggers that causes them that out-of-pocket and that copay. So I'll talk about that. First, I'm going to talk a little bit about just the product features, just so you guys have enough to go off of. But basically, the plan goes from age 0 all the way up to age 90. It is a true accept reject product. So when we have products that are simplified underwriting, we are purely going off of the health questions on the app and then a very liberal height weight chart. So if your client fits into the height weight, they can answer no to all the health questions. They're going to be instantly approved when you submit the app. Okay, we're not going to do MIB, script checks, none of those personal interviews or anything like that. So in most cases, as soon as you click submit, you're going to see right there on screen, congratulations, you're approved. The product is guaranteed renewable for life. The premium factors are going to depend on their issue age. We use unisex here, so males and females pay the same amount. And we let unismoke as well. We actually don't charge tobacco users a surcharge on this plan. So very attractive for a tobacco user. This is one of the few plans where we have family rates, so we can do an individual plus spouse, individual and kids, or we can do an entire family. And there is some discounted pricing when we're coming in and doing, specifically what I see most in the senior market is a husband and wife together. There is just a six-month pre-existing condition, so that means if we have a claim in the first 6 months, we're going to make sure it was not a pre-existing condition from the previous 6 months. And unlike on Prime DVH, we do have a one-time $20 app fee that we're going to take when you submit the application. We went that route as opposed to baking in a policy fee that the client has to keep paying year after year after year, and just use that $20 app fee really to recoup all of our admin costs on the plan. So with any hospital confinement plan, you're starting with that base benefit, and we've really created a lot of flexibility there and how much of a benefit you can offer. So you're going to go anywhere from $50 a day up to $1,000 a day, and any $50 unit in between. And then you're not just going to pick the daily amount, you're going to pick the duration of that benefit as well. So we could do a 3, a 6, a 10, a 21, a 180, or even a 365-day benefit period. Now, you'll see if you go with the larger daily benefit, can't do the super long benefit periods. We would never want to do a 365-day benefit with $1,000 a day and be on the hook for a $365,000 hospital claim. But when you get down to those smaller amounts, I think the 10-day is the longest period. You could do the 1,000, and then we start to cut down what you can offer beyond that. There is an observation benefit built in the plan. This is so big to have on a hospital confinement plan because oftentimes your seniors, they may go to the hospital, but they're never truly admitted. They're just kept there for observation. And this plan was designed that if that happens, even if they are not admitted, if they are there for observation at least 12 hours, we are going to pay them whatever that daily benefit amount is that they have signed up for. We've also built in a mental nervous confinement benefit. And we see more and more mental nervous confinements these days. And that's going to pay the client $250 a day for up to 7 days per year for a mental nervous confinement. So I talked about using the riders, and that's how we really make this plan as something that really syncs up perfectly with the Medicare Advantage. So I'm going to go through some of the riders now. The first one is a lump sum hospital confinement rider that goes anywhere from $250 to $3,000. And what that lump sum rider does is it would pay them that benefit amount on the very first day of a hospital confinement. So it's a great way to just boost up the initial benefit the client gets. And sometimes I see, it's with more than under age 65 space, but agents going with a smaller daily benefit amount, but then adding this in as a way to kind of kickstart that benefit. Another way I have actually seen this in the senior market, I don't know if any of you have marketed any MSAs, but the MSA is the Medicare Medical Savings Account, very similar to the HSAs that we're seeing now in the under age 65 space. And I've had a couple agents particularly that are marketing MSA plans, and they are selling our HospitalWise, and they're actually maximizing this lump sum confinement rider of $3,000 because it's going to give them the money that they need to pay off their high deductible. The MSAs are always paired with a high deductible MA plan, and that $3,000 benefit go a long way in paying that higher deductible. So if any of you guys are in that space, definitely feel free to reach out to me, and I would talk to you some more about what I'm seeing going on with that market. Now let's talk more about the ones, though, that really make sense to pair with the traditional MA. The first is the outpatient surgery rider. So we're going to go between $250 and $2,000 up to twice per year if the client needs an outpatient surgical procedure. The next one for me is really one of the biggest, I think, and when you're looking at the gaps in the MA plans, and that is our skilled nursing facility rider. If you look at most MA plans, they're going to cover skilled nursing from days 1 through 20, but then days 21 to 50, or often days 21 through 100, the client is going to have a significant daily copay if they are confined to the skilled nursing facility. And that's where this rider is such a perfect fit. You see, we've got 3 different benefit periods here. We've got the 1 to 20 day, the 1 to 100, or what you're going to really use when selling this with an MA plan is the day 21 through 100. So it's going to pick up that very first day when the MA is going to start to accumulate that copay. We've got the emergency care rider. So this is going to pay the client between $100 and $500 up to 4 times per year if they have to take a trip to the ER. And a big thing on this compared to some of the other plans out there, that benefit is not contingent upon hospitalization. I've seen some of the HIP plans, they only pay the ER benefit if the client is actually admitted to the hospital after they visit the ER. And with our plan, that is not going to come into play. Whether they are admitted or they are immediately discharged from the ER, they're going to qualify for their emergency care benefit. And that's a really important distinction because these ER riders are one of the most utilized that you see, particularly in seniors on these hospital plans. Oftentimes they may fall or have some sort of other accident happen, and they're going to the ER, and that's obviously very, very important benefit there. Next up is the ambulance riders. Maybe they have to take an ambulance to get to that ER, to get to the hospital. Well, we can pay between $100 and $500 up to 4 times per year for an ambulance ride. And then the outpatient diagnostic rider, we are going to pay between $100 and $500 up to 2 times a year if they have a CT, MRI, PET, CTA, EEG, or EKG. Okay, so that's all the products and features. I never have as fun talking products as features as I do of actually showing how a plan like this can be utilized and make a difference in your clients' lives. And I think this case study we put together really shows a great example of just how this works. Okay, so Jane is 65 years old, and she, was looking at her options. She saw the higher cost traditional Medicare with the Med Sup, and she was really attracted to that lower cost alternative of going with a Medicare Advantage plan. And so she chose one of the best low cost MA plans around, and really happy with the premium dollars that she saved, again, opposed to going the Med Sup route. But she realizes there is actually some significant out-of-pocket exposure here. So if you just look at the left side, this is that death by 1,000 cuts that I was referring to. If she is hospitalized, she's going to have to come up with $285 a day for the first 5 days of that hospitalization. If she has an outpatient surgery, she's got a $250 copay. Takes a trip to the ER, $80 copay, and if she has to take the ambulance to the ER, $200 copay for that as well. And then here we go. This is the big one I was talking about. Skilled nursing confinement, days 21 through 100. She has to come up with $175 a day, and she has a $20 co-insurance for her major diagnostic exams. So, you add all those up, there's a lot of exposure there. And I saw the other day the average MA plans out-of-pocket max in 2019 was $5,059 for in-network services, and it was $8,649 for in and out of network services combined. Now, I think a great way to really position a product like HospitalWise to your MA clients is to just really make them aware that that exposure is there, and ask your client, do you have $5,000 saved away, or even over, even $8,700 socked away if you need to go out of network for any sort of your health treatment this year. And I think you're going to find probably more often than not, your clients are not going to have $5,000 that they just want to have sitting in a bank account waiting to utilize if and when they actually have some health copays this year. And a great alternative to that $5,000 is to do something like what we've done on the right-hand side of the screen here. Okay, we have taken all of those copays and we have built our plan so that's going to pay the client at least enough, in some cases give them even a little bit of an overage. Because remember, this is an indemnity plan. We don't care what the actual cost of service is. They have the trigger, we pay the benefit. So in this case, as opposed to having to have $5,000 to pay these copays, look at this, for $54 per month now, we have just wiped that exposure out entirely. And we did it just by doing a 6-day benefit at $300 a day, the $250 outpatient rider, the $200 ER rider. And again, guys, you can see her copay for ER was only $80. Well, she's going to get a check for $200. That means that other $120 is her to spend as she wishes. We added on, this one synced up perfectly, the $200 copay on the ambulance. And again, that skilled nursing confinement to me is where there's such a big exposure. And we just wiped away that entire exposure for $7.41. And then we did $200 on the major diagnostic rider. So again, you can see for $54 a month, we just filled all the gaps. Now, I have looked at a lot of different MA plans over the last few months and seen what it looks like to fill, to cover those copays. And I'll just tell you guys that obviously it's going to depend on the age of the client and then the underlying MA plan. And some of these MA plans, they have much larger copays than others. So kind of as a rule of thumb, I say, look, if it's a really strong MA plan with really tiny copays, you're going to be able to fill the gaps for as little as $30 a month. If it's one of those kind of more stripped down, low cost versions that has higher copays, I've seen it get up into about the $70 to $75 mark. But really, as a general rule of thumb, think about $50 per month, and we're going to be able to remove that death by 1,000 cuts exposure, as I call it. Now, to me, talking about a product like this and the features isn't something that's going to really resonate with the client, but showing them something just like this case study, I think is what you're going to find really makes it click and suddenly kind of clarifies the need and how this product could be a solution. And I told you guys at the start of the call, we recently launched something that I am super excited about because it makes that cross-sell so much easier, and it really helps your client visualize what this product can do for them. And that is our HospitalWise Senior Plan Builder. Okay, so we have this tool embedded inside of our point of sale tool now. And when you guys are running quotes, the first thing you do is you enter a zip code. Okay, you're going to go forward a couple screens to our product screen, and you're going to see a HospitalWise Senior Plan Builder link in the upper right-hand corner, right there on the point of sale tool. When you click that link, this screen is going to populate for you guys. And what you do is you're going to pick the carrier, the plan year, of course, and the plan name. And once you click view, look what it does. It replicates that case study I was just showing you. So on the left-hand side, it's going to detail, break out every one of those copays. On the right-hand side, it's going to give you the recommendation. Here is how we design this plan to fill in those gaps for the client. I have had a lot of agents having success with this thing. What a lot of them are actually doing, they're printing up the screen before they even go show the client, and they're putting this right in front of their face and showing them, look, here's that exposure. Here's where that $5,000 max out of pocket could come into play. And then here's how we're going to make sure that that's never something that you've got to worry about. So real excited that we launched this. We had a little bit of a delay in getting the 2020 plans up there. They're going to be up there a week from today. So for the next week, unfortunately, you're only going to have access to the 2019 plans. But starting, like I said, next Wednesday, you're going to have those 2020 plans available as well. I wanted to end off just telling you guys a little bit about getting started with us, because we are a little different maybe than some of the ancillary companies you're accustomed to writing. One big difference about us, everything we do is digital. We are 100% online presence. So from the time you start your contracting with us through writing your first piece of business, you are going to do everything online, okay? And that all starts with the contracting invite. So if you haven't contracted yet, you're going to reach out to Premier, and they can send you the invite. Invite's really easy to fill out. It's going to take about 5 minutes to get through. Once you submit the invite, you're going to be a pending agent in our system just while we run your background check. The background checks take anywhere from about 2 to 10 business days typically. Every once in a while, they'll take a little bit longer than that. But a good rule of thumb, thinking, in about a week or so after you've filled out your contracting, you should go active with us. The morning that you go active, you're going to get 2 emails from us. The first email is a welcome email from SureBridge. Okay, it's going to come from produceronboarding@SureBridgeInsurance.com. That email is going to have your agent ID and a temporary password you're going to use to log into our website, our agent website, which is supsportal.com. When you log in, when you use that info to log in the first time, it's going to have you create your permanent password. And then instead of going right to our homepage, it's going to automatically launch our new agent orientation. Okay, so you're going to want to just, take a little bit of time going through that orientation. Gives you some great background on the company, the products, kind of the, the do's and don'ts of doing business with SureBridge. At the end of it, there's a super easy 10-question quiz. And once you guys get through that orientation, then you're going to be able to get right to the homepage. Okay, the next thing you're going to want to do there from the homepage, there is a direct deposit tab. Another thing, we're a little different than some other carriers. In other carriers, you fill out your direct deposit when you're getting contracted. Well, with us, we're going to default you to a paper check. So if you want to get the direct deposit, all you got to do is once you get through that orientation on the homepage, you're going to see there is that tab. You're going to click on that tab and follow the steps to get your direct deposit set up. So after you've done orientation and done your direct deposit, the last thing you need to do before you're ready to sell, I mentioned you get 2 emails when you go active. The second email does not come from SureBridge. It comes from DocuSign itself. We use DocuSign on all of our applications. Again, everything you guys write is going to be through that online portal. And we are going to use your DocuSign account to put your digital signature on every one of those apps that you submit. So it's a real easy process to set up. You're going to get an email that looks like this. You're just going to open up the email, click activate. It's going to have you create your account. You're going to set up a password. And the real big thing that you got to make sure you do, when you get here, this is the DocuSign homepage. Over on the right-hand side of the screen, there's a little blue link that says create your signature. You just click on that link, get your signature set up, and when you're back on this page, it'll actually show that digital signature right there on that portion of the screen. So you'll know once you have activated your DocuSign, you are 100% ready to sell with us. We've done that in the orientation. And then what we have created too to help you guys through that first step, I know the first step's always the toughest. We have created some demo videos that go end to end on how to use that point of sale tool, from building your quote to doing all of the different enrollment and signature options. We've really got 4 main ones that we utilize. You're face-to-face with the client, we've got a face-to-face enrollment option. If you're selling it on the phone, which a lot of our agents do most of their sales on the phone, we're going to have 3 options. We've got an email signature, we've got a text signature, and for your clients that you may worry might struggle with doing a DocuSign on their end, we've got a voice signature option. And that's a great one for your clients. Again, if you're just worried about their tech savviness, all they need for that is just a voice authentication. So great, got a number of different great ways to enroll these plans. I think you guys are going to find, the benefits, again, of doing that online app is that instant gratification. I love nothing more than clicking submit and seeing right there on screen, congratulations, you're approved, and not have to worry about faxing that app into a home office and having somebody process it and cross your fingers that you didn't forget a signature or to check a box. And then on top of that, guys, we pay out our commissions twice per week. So you combine that instant approval with the paying out commissions twice. Like, I don't think you're going to find any other ancillary carriers out there. They're going to have a quicker turnaround time from writing a piece of business and having that money deposited into your bank account. So something we're really happy with is our quick turnaround time on issuing your guys' policies and paying you the commissions that you guys deserve. So with that, John, that was all that I had prepared. I would love to hear what sort of questions we might have.
Mike, one of the first questions is one that we field quite frequently, and that is, do you have any literature that shows the affiliation with United Healthcare?
Unfortunately, we do not yet. We are still kind of the newest kid on the block with United, and we have not yet built any formal marketing documents around that. But I'll tell you, it is something that is most definitely on our radar, and we will distribute that to the masses as soon as we've got it. But I think with everything else going on right now, that's probably going to be something you guys won't see until 2020.
Okay, and then I'll have an ancillary question with this, because when John put that in the system, Google brings up the AM Best upgrade and the alluded takeover or purchase by United Healthcare. This piece, if it was handled in its entirety, what do you feel as to the compliant use of it, or is that something that you would recommend in the meantime, or stay away from it?
It's that's a great idea. I didn't really think about this. This is a public announcement, so there is absolutely no reason you guys shouldn't be able to print this out and show in its entirety to your clients. I think anything we can do, obviously, if we want to leverage that United brand, and especially if you guys are selling a United Med Sup or United MA plan, it looks so good to say, hey, look, your ancillary is actually part of the same great company that you're already buying your Medicare through.
Okay. In that case, then, I'm going to cut and paste this, including the link to the internet source for this, and include it as part of the follow-up to today's presentation. So, John, you kind of have a second-hand alluded relationship there, but that, as Mike said, is public information, and as long as we cite it in its entirety, that will be okay. And believe it or not, Mike, because of the depth of your presentation, that's the only question that we have on the products themselves. So I want to thank you for that presentation, and we'll roll through a couple of things that might be helpful as well. I appreciate the insight that you delivered with different questions to help sell. Here's a couple of additional tips I think that folks might find helpful in incorporating the dental sale into the Medicare piece. And many times, if we're offering Medicare Advantage products or prescription drug programs, we have the requirement to have the scope of appointment in play ahead of time. Utilizing a generic scope of appointment includes dental, vision, hearing products as part of that sales confirmation form. utilizing it in this circumstance where we have the products as part of the scope of our presentation. It's a natural lead-in to some of the additional programs that the folks need, including both of those that Mike cited today, the dental vision hearing product and the hospital indemnity program. It's a nice use of a requirement imposed upon us by the government to help us with a expectation of additional conversation. Also, for many of the agents that sell Medicare supplement programs, they make use of the Medicare and You Bible in a manner of speaking. And on page 49, it speaks to what's not covered and goes into the dearth of coverage that dental has under the Medicare programs. And we also have a topic of discussion with many of the Medicare supplement programs, the F versus G, because of some of the MACRA legislation that comes into play on the first of the year. And in this particular circumstance, using that same Medicare and You book, page 69 speaks to what's not covered on a Medicare supplement when it comes to dental programs as well. And of course, as we go through our presentation for Medicare Advantage plans and we discuss the coverage that is there, which, as Mike mentioned, in many cases is limited to preventative care, it gives us the opportunity to speak to the need for additional coverage as well. And here, I think, is the biggest piece that comes into play, and Mike mentioned it as well, and it's the old, you never get kissed if you don't ask. Pepe Le Pew and Penelope, that shows my age more than anything, but it's the natural next step of how do you handle dental expenses? It's a simple question, and it doesn't require any type of real slick upgrade or anything else. It's just remembering, if nothing else, using the Columbo close as you're finishing your presentation and you're walking to the door. By the way, one more thing. How do you handle your dental expenses? Field kiss. Some additional things that you'll get for Premier by contracting with us. We do have a system that helps you create an agent profile so you can store all your contracting information into the system. It then gives you a repository to contract with carriers that don't have some of the electronic contracting systems in play to make it very simple for you. And we do also offer a discounted errors and admissions coverage to qualified agents. What makes you qualified? You contract with us. It then, however, gives you a policy that covers you regardless of the insurance product's origin within your portfolio of products. What the heck do you mean by that, John? You're an independent agent. You have an opportunity to contract with multiple organizations. This will cover you regardless of how your contract originates with an insurance product and covers you across the board at a very reasonable rate. We also help you keep your insurance license in play. For many of us that are grandfathered in certain states, there's still a requirement to do certain things for Medicare to continue that offering. This gives you bundled continuing education programs through our affiliation with WebCE. And as an independent agent, you're responsible for your own benefit package. This gives you an opportunity to pick up non-cancelable DI coverage for yourself on a modified guarantee issue basis where you enjoy discounted rates and share in the commission of that product. Much as today's presentation is being recorded, we record a number of other webinars. They are available on our website, and they're also available on our YouTube channel. And they include not only product information such as today, but also different marketing programs that can be beneficial to you at this time of year when so many people are out there hustling business in AEP and looking for leads to offer presentations on a compliant basis. We also offer electronic support in different quoting tools. This particular tool also gives you access to a system similar to what Mike was referring to, where you can identify a Medicare Advantage program that is in play. And let's face it, in certain markets, certain programs have a sterling reputation and people aren't going to change their coverage. However, it gives you an opportunity to identify those needs for additional assistance, including dental programs, hospital indemnity programs, perhaps a critical illness cancer plan even. This tool, in addition to that function, helps you quote the med subs that give you access to that portion of the Medicare niche market, and it's available to you without cost with contracts through our organization. We offer the same sort of access to our Medicare Center program, which gives you the opportunity to also sell Medicare Advantage and prescription drug programs remotely, store all the information. It does away with the challenges that you have with some of the new Medicare Plan Finder challenges, and it and the quote engine referenced earlier both give you an opportunity to collect that scope of the SEO, the scope of appointment, SOA, without actually being face-to-face with an individual. It's an electronic function. We also have a program that enables you to put your social media marketing on autopilot through our Coverage Made Easy program, and we place all of the incentive programs in a central location for you to make certain that you're maximizing the earnings you get and the incentives that are available to you by selling different programs. SureBridge is one of the programs that gives you an opportunity to qualify for the Premier Producers Convention, which this coming year in April is a cruise from Miami to the Bahamas. So if you're one of those sun worshipers, that's a great program for you to access. We also give you different lead programs that are made available to you, contact lists that for you folks that are comfortable with your relationship with Mob Val are available to you. We give you also different hints and tips on working the different community-based marketing programs, including the retail programs that are started up and have been very effective for a number of agents this year so far. Accessing different centers of influence in the community, including faith-based organizations and providers with the different programs. Some of the carriers also make available at this time of year different prospects that they generate as part of their marketing efforts. Most of the time that's centered around different marketing efforts by Medicare Advantage programs. We do have Facebook lead programs that are available, and we do offer direct mail support based on production that drives down the cost of mailings for you through our approved lead vendors. It's all an opportunity that we share in working with each other, and we'd like your business. So as we've gone through and reflected on the programs that are natural add-ons for Medicare sales, it's then a determination on your part as to whether or not you want to make that simple step and make that a part of your personal marketing program. If you do so, well, as John Wayne said in the Cowboys, we're burning daylight. Time to do it now. We can get you additional information, but you can reach out in the meantime as well. All of the premier health marketers are available through our toll-free number at 1-800-365-8208, or you can access additional information through our website as well at premiersmi.com. I want to thank you for coming on the line with us today and invest precious time during AEP with us. We look forward to the opportunity of visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so very much, and watch for the follow-up that will follow. Thank you very much.